Good morning. Thank you for joining me as I discuss one of my favorite topics, which is diabetes, diabetic foot care, and really how diabetes affects overall wellness and health, which is one of my primary concerns. I'm Dr. Meredith Warner, and I own Warner Orthopedics and Wellness, which is sort of a culmination of my vision of providing really good, holistic, whole body health and wellness for people. I am a fellowship-trained orthopedic surgeon, fellowship-trained in foot and ankle surgery in particular, but I have a deep love of the human body and how it works. Even though I operate really all over the human body and primarily on the foot and ankle, we do a lot of wellness work, which of course would incorporate assistance in the care of diabetes, particularly in this state where it's got a very heavy prevalence. Dr. Kyle Lindow is a recent addition to my practice. He's a very well-trained, hindfoot certified, ankle certified podiatrist, and he has a real love for diabetic foot wounds, believe it or not. He is an expert in the care and treatment of them, and he's been an awesome addition to sort of the services that we offer the community. So what you'll find here in my new clinic, which is on Airline Highway, is complete wellness. We want you to have the most optimal aging possible. We want you to have the most functional aging possible. And under one roof, we can offer you orthopedics, physiatry, podiatry, physical therapy, functional fitness program to include personal fitness, yoga, massage, natural and aesthetic wellness services. And we are also able to assist you if you seek herbal regimens, natural medicines, complementary alternative. We have a deep understanding of all of that. And so we'll bring to you musculoskeletal care in a new way that is a comprehensive way. So in other words, we don't just pick a body part and that's the only thing we treat and we send you somewhere else to wait for 4 hours to go have another body part looked at and so on and so forth and so on. We'll help you look at everything in sort of a general bird's eye view and then make you as good as healthy and as well as you can be. So this is our clinic, and we've designed it to be very open, very bright, very clean, very healthy, and all of the design features are functional. So we're able to provide yoga. We have a full space for that. We're installing an infrared spa that will allow us to provide that level of therapy for people. And we have a physiatrist that can do nerve conduction studies. As I said, I have a very awesome PA who does our aesthetics work, and I've got Kyle Lindow, who's in the bottom left of this picture. And then my team is really, really good, and my team is vested in your health as well. They're not just here to work, they really get involved, and they really love our patients. I'm very thankful for my team. So one thing that we've started that Dr. Kyle Lindow is doing is at-home wound care. So if you or a family member is in Medicare and has the red, white, and blue card, and has a diabetic foot ulcer and you don't want to come to an office or for some reason you can't, Dr. Kyle has actually started an at-home wound care program. And they'll get all of the products and instrumentation and procedures that are needed certified first to make sure everything's covered, set it up, and he'll actually come to you and help you take care of your wound, which has been a great service that we've been able to offer. It's very innovative. No one else is doing it. And we're bringing it to Baton Rouge and the surrounding community, of course. And Dr. Kyle has a clinic in Zachary as well. So today, let's talk about diabetes and really in particular, foot care as it pertains to diabetes and why it's important. So what is diabetes? First of all, you probably have diabetes. If you don't, you have a family member that has diabetes. That's how common it is, particularly in this state. Diabetes is a disease that changes how your body handles sugar. Remember, sugar is just a carbohydrate, right? It's just a form of fuel for your body, and it's what we eat on a daily basis. But your system, if you have diabetes, can't handle it right. It doesn't process it right, and that just changes everything in the human body. There are different types of diabetes, type 1 diabetes, type 2 diabetes. There's also gestational diabetes, which happens to women when they're pregnant. Diabetes can be induced by medications, especially chemotherapies. And think of it like this. It's not a hormonal problem. It's not really a musculoskeletal problem, but it'll change your hormonal system. It'll change your musculoskeletal system because it's a metabolic disorder. Metabolism is the total sum of all of the chemical processes that occur in our cells to produce energy. So obviously, your metabolism is necessary for every other system to function well. And if your metabolic system is disordered or messed up, everything else will be too. Some of the symptoms we talk about, and you've probably heard of these: fatigue, or you just kind of feel tired all the time. You're thirsty all the time, or you're hungry all the time, and it makes no sense because you just ate or you just had a glass of water. If you get a cut or a wound, a burn, you notice that it takes a lot longer to heal than it used to, and it doesn't really make sense to you. Frequently want to get up and urinate for no apparent reason. And then some people will actually develop numbness in their hands and feet, and that's actually their first signal of diabetes. So just remember, though, you can't really self-diagnose diabetes. Only a blood test will tell you, and it has to be a specific blood test. Fasting blood glucose is one. We check other different levels in your blood, and we have a way to test an average of blood sugar over the past few months I'll talk about. So really, you got to go see a physician to get diagnosed with diabetes, but you can look for things like this list here of different symptoms. So being thirsty, urinating more often than would make sense for what you're drinking, feeling very hungry, feeling very tired, losing weight without trying, sores that heal slowly. Another sign is dry, itchy skin, particularly on the bottom of your foot. And you put lotion on it, it doesn't matter. It's always dry and itchy. It always looks bad. It's always flaky or ashy. Feelings of pins and needle in your feet, or your feet just feel sort of numb, or they feel like you're walking on pillows, or they just don't feel normal, like you really don't know where you are in space. And then eyesight changes, and that's definitely a reason to go see a physician. So you've heard of diabetes. I kind of told you what it is. Your body doesn't process sugar right. It's a metabolic disorder. And you know it has to do with insulin, but maybe you don't really know what all this means. So let's start at the top right, glucose. Glucose is your energy source. This is carbohydrates. This is if you eat bread, if you eat sugar, you have some honey, you're going to get glucose. And that is a source of fuel for your cells at the mitochondrial level. Well, how glucose gets into your system, or the hormone that regulates it, is insulin. And that's why insulin is important. A hormone called insulin allows each cell to use the glucose that's floating around in your bloodstream. The pancreas, you may have heard of the pancreas, you may not have, but the pancreas is the organ in your body that actually makes the insulin that your body uses to put the glucose in the cells. And that's pictured here underneath the liver, which is the big sort of burgundy organ in this picture. There's a little green gallbladder. Under that, you see sort of a yellow flag. That is your pancreas. And then HbA1c, perhaps you've heard of this. Everybody asks you, oh, what's your HbA1c level? Or ask your relative or your grandmother. And the HbC gives us the average of your blood sugar for the past 3 months. So we can use that to test to make sure that you really are under control, because most people have no ability to remember medical things, and that's just normal. So it's hard to remember what you've eaten, what your sugars were, et cetera. But we have a way to sort of check the average in the past, okay? And that's why people check your HbA1c. And this sort of shows you why this is important. So the bottom shows you red blood cells, and glucose will actually attach to the red blood cells if you have elevated levels of sugar in your blood because you don't have enough insulin to pull it out and put it in the cells to form fuel for your cellular processes. Well, we can measure the percentage of this, right, the A1C percent, and then that tells us an average of the actual number of what your blood sugar's been for the past 3 months. So it's a pretty cool tool that we can use to kind of gauge where you are on things. And the way I use it, for instance, as a surgeon, if I have a patient with an A1C that's double digits, so when you start getting over 9 into the 10 zone, I know it's better to wait to do your surgery, if possible, for us to get that A1C under control, to get your blood sugar under control, because your infection risk goes up, et cetera, et cetera. And you could see it's like a pyramid. So we know this is why we want your number to be 5 or 6, because that means your blood sugar on average is 126 or less. If you're rolling in here and your A1C is 12, we know you're running an average of around almost 300 on a daily basis, which is not good. So that's why we check the A1C, and hopefully this makes sense to you. And now you understand this tool as well. Maybe it'll make more sense to you. So let's talk about type 1 diabetes really quickly. This is an autoimmune disorder, okay? This is when your immune system, your immune cells that are there to attack viruses, start to attack yourself. And in particular, they'll attack the beta cells inside the pancreas, which is where the insulin is made. So think of it like terrorists attacking the factory. They're gonna take out where the insulin is made and just ruin everything. And so you can see on the top right, it sort of shows you insulin will lock into a receptor, and that opens the green hole that lets glucose into the cell. Well, if you're attacking the production of insulin, you don't have that key to unlock the cell anymore. So this is the one that we think of as hereditary, that you're born with it. So we see this often in children. So, young people that have diabetes, by and large, they're going to have type 1. Although I will tell you, with childhood obesity, we're seeing more and more type 2 diabetes very early on, which is not good for this country. These people will have thirst, fatigue, GI issues, different stomach pains, bowels aren't correct, they're urinating too much, everything's just sort of not right. And then the fatigue, things like that. So if you have a child that's having these kind of symptoms, you may want to get them checked out. Type 2 diabetes is what we sort of all think about as the lifestyle diabetes, or what is associated with obesity and just eating lots of sugar all the time. So this is more common, very common in our country, and becoming more and more common in almost every developed country in the world. For instance, there's a massively high rate in Saudi Arabia, believe it or not. There's a very high rate in certain populations, such as Eskimos and certain Indian tribes. So we know there is probably some type of a genetic component, but that's being looked at and researched. Basically, in this case, your pancreas works. There's been no attack of your pancreas. There's no autoimmune disorder. So you're making insulin, but your body doesn't know how to use it. So the cells aren't letting the insulin become that key to unlock the glucose hole, right? So this is what happens with years of too much sugar floating around in your blood. That's why it develops usually later. Although, like I said, now with more and more obesity in childhood, we're seeing it earlier. It's related to really how much time blood is floating around in your sugar. So it used to be only in adults, but now in America, it's starting to be earlier. This is what we call now in medicine a chronic inflammation disease. Most of our big problems in America, cancer, heart disease, diabetes, Alzheimer's, things like that, we know now, due to low levels of constant ongoing chronic inflammation. And obesity leads to this because adipose cells produce inflammatory mediators. This also has the same symptoms as type 1, thirsty, hungry, urinating inappropriately. But some people have no symptoms, and that's the scary thing. How do we treat this? The number one best way to treat it is diet and lifestyle changes. But I'll tell you, sometimes you have to go as far as having a sleeve or a bariatric surgery, and that can be life-changing. For instance, Pennington Research Center here in Baton Rouge is doing a ton of research on this, and they actually have a bariatric program. I actually just got a patient into it. So they're really helping our community out too. Sometimes diet isn't enough to get the levels of adipose or obesity down to help treat the disease. And then also medications, insulin, and we're going to talk about that. So here's a scary thing, pre-diabetes. So we know that diabetes is high in Louisiana and in the United States, but pre-diabetes is probably even more. We think 86 million people have this right now in the country, but 9 out of 10 have no idea that they're pre-diabetic. Now that is scary, right? Because if you catch it early when you're pre-diabetic, you can prevent diabetes from coming on by treating it. But if you don't know, then you might let the cat out of the bag and it's too late. These people have a higher risk of heart attack, higher risk of stroke, and they don't even know it. Their blood sugar is too high, so you go to the doctor and it's always just a little bit too high, but it's not high enough to meet the criteria to technically be called diabetes. So this population is basically just sort of missed, and nobody's treating them. Although I will say nowadays, a lot of the primary cares are looking for it, which is really helpful. and I think going to help us out in the long run, perhaps making that curve go down in terms of the number of diabetics. So obesity and pre-diabetes are obviously underlying risk factors to develop type 2 diabetes. So what does diabetes do to you? What does it matter? Who cares if I have diabetes, right? Well, here's why. It doubles the risk of heart attack. It doubles the risk of stroke. It can cause kidney failure, which puts you on dialysis. It causes blindness. It can cause amputations, and I'm going to talk about that obviously more detail, and that's based on the effects on the feet. Every 23 seconds in this country, somebody's diagnosed with diabetes. More than 60% of these people aren't going to figure it out until somewhere around my age, somewhere between 40 and 64. In 2014, I didn't have any more updated data for you, 1.4 million were diagnosed. These are scary numbers if you think about it at the macro bird's eye view of the country level. Here's a great schematic of the cell membrane and how diabetes and insulin works. This is sort of the things I like to look at. It really kind of brings it home to me, makes me understand it. What you're seeing there is a cell membrane. So those lines of bubbles is the cell membrane. So every cell is, think of it like a balloon, and it has a membrane, which is the rubber part of the balloon, right? And it's filled with cellular products inside, whereas you would fill a balloon with air or water. And then you have the membrane that separates it from the environment, which in this case would be the rest of the body. Well, the membrane has millions of holes in it, millions of receptors and pores, and it'll let things in, let them out, let them in, let them out, and that's regulated by other receptors. So in this case, we've got the insulin receptor. Insulin's floating around, made by the pancreas, attaches, and it attaches and lets glucose into the cell based on what happens at the DNA level. So the insulin gets phosphorylated, triggers a reaction at your DNA level, so the nucleus. The DNA then produces molecules that force the glucose pores to open. In this case, the GLUT4 transporter in particular. So obviously there's at least 3 others, right? The beauty of this, though, is, and this is something for you to think about, physical activity can trigger the GLUT4 pore to open as well without insulin. And that's why exercise is so important when you're treating diabetes. Anything you can do to stimulate that GLUT4 transporter to open, allow insulin into the cell to be utilized in an effective manner and get it out of the bloodstream is good. So you can actually change your blood glucose levels by exercising with or without insulin. So that's a neat trick that you need to keep in mind. So the basics of treatment. Now, obviously, I'm an orthopedic surgeon, and I'm very into wellness and natural medicine. I'm not a primary care doctor, certainly not an endocrinologist. I love this stuff, read about it all the time, so I'm gonna give you the basics. Metformin, probably if you're not on metformin, somebody is, right? And we're using it more and more often for different reasons, and we're treating pre-diabetes with metformin now, which is pretty good. This decreases the liver's production of glucose from other fuel sources, right? So fats and things. But the liver will make too much glucose sometimes and add to your burden of sugar. Well, metformin kind of regulates that. Then we have your anti-diabetes meds, and that's sort of a general term, very vague. In a nutshell, they increase the cell's ability to recognize and respond to insulin. So remember, type 2 diabetes is insulin resistance. You're making enough insulin, probably making too much insulin, but the cells don't recognize or use it right. Well, these anti-diabetes meds make the cell a little bit more effective in using the insulin that you're already producing. These are your glucotrol, Actos, Amaryl, Avandia, Invokana, Victoza, Januvia, Onglyza. I mean, watch the TV for a while, you'll probably see 8 commercials. That's why these meds are out there. Some people have to be on both, metformin and Onglyza, we'll say. And then if the oral meds stop working, then you have to start adding insulin. And then there's short acting and long acting. If it gets really bad, some people have to have an insulin pump that constantly produces insulin based on readings of blood sugar within the pump itself. So back to the feet. How does diabetes affect your feet? Like, why do diabetics get diabetic foot ulcers, and why is there an amputation rate? Well, let's start with the basics. Diabetes affects wound healing, immune cells, and connective tissue. Skin is a form of connective tissue, so you'll get calluses from pressure points, right? From abnormal forces in the foot and bone. Think of it this way. If you get a muscle contracture in your foot because you've got a tight thick muscle that's not moving right, that's lost its flexibility, which diabetes does, then you'll get a pressure point in your foot and the skin responds by forming a callus. You know how guitar players all have calluses on the tips of their finger from constantly fretting? That's a similar thing. You've got an overload point on the bottom of the foot from some bony prominence and you form a callus. Fungal issues or infections, particularly toenails, will become just taken over by fungus. Blisters, which make no sense, like you wear anything and you get a blister. Swelling for no apparent reason, and that's because diabetic tissues fill with fluid. There's not good fluid management because the cellular processes aren't working right. Poor healing abilities, we already talked about that. So like you step on a rock, you don't really notice it, and then that turns into a big sore that never heals. Whereas normally, like when you were a kid, it would heal in a day. And then you Charcot neuroarthropathy, which is one of my specialties, and that's when diabetes is so extreme that the foot just becomes completely deformed and you just get huge ulcers that nobody seems to be able to handle. These are the people that are at risk of amputation, and my primary concern is limb salvage, so we do everything we can to prevent an amputation. But this is where it all starts. In 2012, think about this, and this is 8 years ago, right? Louisiana spent $4 billion on the care of diabetes, and a lot of that, believe it or not, is foot care. So why do the feet go bad? Well, one of the primary reasons is diabetic sensory motor polyneuropathy. So instead of me saying that all the time, I'm going to say DSPN, or I'll just say neuropathy. So diabetic foot ulcers and then diabetic amputations usually are a direct result of diabetic sensory motor polyneuropathy, okay? 33%, a third of diabetics have neuropathy. 25% will have a painful neuropathy, but 50% have no complaints. And then the other 25% just have vague, weird complaints that aren't really pain, but they aren't symptom-free. But it's scary to know that about half of the people with neuropathy have no idea they have it. And it's actually more common in the group with pre-diabetes, that 86 million of people that we talked about, than it is in diabetes. Polyneuropathy is a length-dependent disorder of the nerves. What does that mean? It's going to affect the nerves that are the furthest away from the brain and the spine. That's why it affects the toes first and the fingers next, right? So people will feel what we call a stocking glove distribution of burning pain or numbness. It'll feel like they pulled their socks on. It starts in the toe, goes to the ball of the foot, goes to the midfoot, then the heel, then up the leg. Same in the hand, just the same as you're putting a glove on. Tips of the fingers, middle fingers, palm, then up the arm. So the longer the nerve, and obviously the longest ones go out to the ends of the limbs, particularly the toes, those are going to be affected first. And it's from the impaired metabolism. We talked about metabolism already. And impaired microcirculation. So a lot of diabetics have peripheral arterial disease that goes with the diabetes. And this affects not just the big vessels like the aorta and where people get stents. You probably had somebody that's had a stent either in their heart or their legs. Well, the teensy tiny vessels that are unstentable because they're too tiny, they get clogged off too. And then that means the nerve has no blood supply. So it's like a double whammy. It's a progressive and a chronic disorder. It's really not curable. We can make it a lot better, but there's really no cure as of yet for neuropathy, and it is very underrecognized, very undertreated. We're experts in this. We look for it all the time, but I'll tell you, there's a ton of people walking around with diabetic peripheral neuropathy that have no idea about it, and they're going to be the group that is at risk of amputations in a little bit of time. So one German study, for instance, showed that they looked at a group of people with painful and painless neuropathy, okay, and they had type 2 diabetes. The painful group, 57% of them were undiagnosed with diabetic neuropathy. So here's a diabetic with a painful foot and nobody diagnosed him with neuropathy. 82% of the painless group. So here's the problem. A diabetic goes to see their doctor and they just get their blood sugar checked, the A1C. Hi, how you doing? How you feeling? Okay, great. Here's your meds. See you later. Well, you have to do a diabetic foot exam and you've got to screen for neuropathy so that you can catch this and potentially manage it and keep it from getting worse. That's what we do. We're excellent at screening for diabetic polyneuropathy, and we can even go as far as the nerve conduction studies that'll pick it up as well. And what will happen is you have abnormal pressure sense. That's why you can develop a callus and eventually an ulcer from an abnormal contact point. You don't feel vibrations the same way. You lose your sense of position. So a lot of times you have balance problems. And then you really have temperature issues. So I actually had a patient once whose diabetes was so bad, he was doing Epsom salt soaks and ended up getting like a frostbite reaction from soaking in the water too long because he didn't feel that his skin was changing. So it can be very scary. If you even think for a second you might have this, you should probably get screened. So again, when do you go see a doctor? Obviously, if you have diabetes, you're on scheduled appointments, keep them. Probably come see somebody like me or Dr. Lindow to make sure you don't have neuropathy. And then if you have diabetic foot ulcers, obviously we can treat those to completion. A lot of people will end up going to wound care clinics, which is fine, but what they do is manage the wound, like pain management. They just manage pain, they don't cure it. They just manage the wound, they don't make it go away. We'll actually do everything we can to take that pressure point off of the wound, move the tissue around, improve your overall health, and try to get that wound to actually go away. You should do a foot exam daily. And one trick I tell people to do is a face mirror in your bathroom, just put it on the floor if you can't pull your foot up to look at the bottom of it, which a lot of diabetics can't because they're too stiff, you can just hold your foot over a face mirror and look at the bottom. Make sure you don't have dry, cracked skin. Make sure you don't have a sore you didn't feel. Make sure there's not a splinter sticking out of your foot. Believe it or not, a lot of diabetics have so little sensation that's happened. And probably you should see one of us at least every 6 to 12 months. I follow my diabetics very, very closely, and I'll have them come in for an x-ray, whether they have issues or not, because I know that they don't feel everything normally. Even stepping off a curb, you can end up with a compound ankle fracture and have no idea. I've seen it before. So what do we do surgically? You might be interested in that. You might be running away from your screen right now. We do ulcer debridements and we do wound management, just like a wound care clinic if necessary. But our goal is to get rid of the wound and let you quit coming to a doctor, except for those follow-up visits we talked about. But we don't want you coming to see us every 3 days or every week just to have your wound debrided. We want you to get better. Diabetic wound care is one of our specialties. Like I said, Dr. Lindow will actually come to your home if you're Medicare and you have a diabetic foot wound. Limb salvage, Charcot reconstructions, that's my specialty. So I do everything in my power to keep you from having an amputation. And then surgery just to offload and change the shape and balance of the foot to get those pressure points gone. And that is really the key to letting a diabetic foot wound heal, but also making sure you have blood flow. And we work very closely with some excellent vascular surgeons to make sure that microcirculation is opened up. So is amputation always necessary? Well, you would think so based on what you read and how you hear other doctors talk, but it's not true. Here's a person that I took care of, and on that, you see this diabetic wound next to the pinky toe. Well, a lot of doctors would normally just amputate the fifth toe and get rid of that side of the foot, right? Well, what we did was a minimally invasive bone cut to lift the bone up, and then we did this advanced tissue transfer you see on the bottom and covered the diabetic foot wound, and it healed really within 2 weeks. And this gentleman's walking around now in just a basic pair of diabetic shoes, where he had been in wound care for about 1.5 years before this. So if you think these problems through and apply all the technology we have available in 2020 in America, you can actually get things to heal, and you don't have to amputate. So amputation to me is a last resort if it's really, there's literally nothing left to do. Some complications can lead to emergency surgery or amputations. We'll say an infection of the bone that fails normal treatment. But know this, even if you have a bone infection, that is treatable. That does not necessarily mean you have to have an amputation. Abscesses, big pus pockets inside your legs or feet, also treatable. You just surgically drain it and then you go on from there, not necessarily a real reason to have an amputation. A Charcot foot or a neuroarthropathy foot that fails all other treatment. These are the deformed foots with an upside down arch that bend outwards, that don't fit any shoe because all shoes are designed to go like this. Those feet are the ones that get really bad ulcers because of the pressure points. We can actually rebalance those feet to take those pressure points away and get you in a diabetic shoe that will fit you. But remember, limb salvage takes time, it takes effort, it takes innovative thinking, and it takes a lot of care. Amputations are faster. I'm not saying that's why they're all done, but a good limb salvage program is you have to be very thoughtful, and we like to think of ourselves as experts in this. So amputation. Diabetic neuropathy is responsible for, we think, nationally, 50 to 75% of diabetic ulcer amputations, linked directly to the neuropathy that, remember, I told you goes underdiagnosed and undertreated. So really, we could be doing a better job as a medical community of picking this up earlier and preventing these sores from ever happening in the first place, which of course then prevents an amputation. Peripheral arterial disease, or PAD, very important comorbidity or cofactor with the neuropathy. So if you have both, your risk of amputation is skyrocketing. But also remember, if you have an amputation, your death risk goes up. So it's very important to try to avoid these procedures. There were 73,000 amputations done in the United States in 2010. There's been more recently. In a 2008 study, we realized from Medicare data nationally that there are certain pockets in our country that have higher amputation rates for any given ulcer or any given diabetic, and that's sad. More likely to have an amputation if you live here than if you live in California, if you live here than if you live in Delaware. Arkansas, Louisiana, certain pockets of Texas down by the border, Oklahoma, Mississippi have the highest amputation rates. Louisiana has really one of the highest in the country. We have 7 to 8 per 100 patients that present with these problems versus a 4.5 per 100 average, and then the good states are running at 2.4 to 3.5. So we're almost 4 times more than other states in terms of amputation rates. And to me, that's sad. And that's one of my missions in life, is to try to make this community up to par, if you will, with the rest of the country in terms of that. And limb salvage and good, excellent diabetic foot care is part of that model. Here's a picture to show you that. The bottom right and the top right, the red zones are the high amputation rate zones. And then the rest of the country, you can see how we line up. And, you know, if I could get us even to the green, I'd be thrilled. But my real goal is to get us to the blue in the top of the picture. So you just have to care. Here's another person I took care of. So you can see she presented to me, that's her foot hanging from a dislocated broken ankle that had been infected before. And she was just left like that for 2 years. She was doomed to life in a wheelchair and didn't need to be. So we took her and put in a carbon fiber nail like this and fused her. And now she's walking around, losing weight, starting to live her life again and be happy. And before, she had just been left and told her only option was an amputation. Well, I wasn't raised that way. So I did everything I could to help this lady. And I think she's going to have a much better golden years, if you will. And I'm just thankful we have such technology to apply. Here's another thing we do. This is a technique, believe it or not, that was developed in Russia in the 60s. This is called an Ilizarov, or a ring fixation device. And this device, although it looks Frankenstein-like, is almost like magic for diabetics that are facing amputation. You can treat an infected bone to completion and save a leg with this device, and you can walk in this device. That's why it's so awesome for people. I only put this on in extreme cases where there's no other option, but this has saved so many legs, I can't even tell you. It's a great device. Not many people know how to use it or have been trained to put it on. I was fortunate to have excellent teachers at Tulane, where I did my surgical training, and then went on in the military. So I have been trained in this technique, but these are the things we do for you, Dr. Lindow and I. We will go to massive extremes to try to make sure that our diabetic patients have the best care possible. So what can you do for yourself so that you don't end up in surgery with those obviously extreme situations? Keep your nails trimmed. That's pretty basic. Wear your clean socks that allow airflow. So your socks are super important. Change them a couple times a day, because remember, if you're a diabetic or you have a family member, and if they have autonomic neuropathy or a sensory motor neuropathy, they don't sweat right. Their skin changes too much. They get dry, cracked skin. So you got to keep it clean, keep changing the socks to regulate the moisture levels. Inspect your feet daily. We already talked about that. Wash your feet daily. Monitor your eating habits. And what I mean by that is try to avoid highly processed foods that induce inflammation. So if you had to pick between, let's say, a peanut butter sandwich and Cheetos, you should pick the peanut butter sandwich, because Cheetos are highly engineered, highly processed foods that induce inflammation. The more natural foods, the closer to how they look when they come out of the earth, the better. Avoid smoking. Smoking is probably the worst thing you could ever do in general. to yourself, but especially if you're diabetic with neuropathy. So that kind of goes without saying. Smoking kills almost 500,000 people in this country every year and has done so year after year after year. I don't know why we're okay with that, but if you are diabetic, I just beg you, please quit smoking. And there are meds we can give you to help with that. Refrain from inflammatory things like alcohol as much as you can. Most importantly, if you think you have diabetes, pre-diabetes, or you do, just make sure you go see someone, your primary care, nurse practitioner, even a physical therapist, just go see somebody and make sure you're in touch with a professional in the healthcare environment that can guide you if you start developing a pretty bad problem, okay? So natural treatments, you might be wondering. Most people that come to my practice know that we're all into wellness, health, and natural remedies. There are some natural treatments for neuropathy, and we're developing some as we speak, but natural treatments aren't really going to cure your neuropathy, just like, honestly, Western treatments are. But I think they're a good adjunctive method if you have full-blown diabetes and diabetic neuropathy. And we'll talk about a few of them. I'm going to talk about one right now. But I think these should be part of your program, because if you are on a good natural or complementary health program, you can actually see a reduction in the synthetic medications you take and a reduction in surgeries and things like that. So lifestyle change is probably the most important, and this is difficult for people, and we'll help you. It's baby steps, in my opinion. You don't have to be Madonna or J-Lo with a personal chef and working out 7 times a day and having oxygen treatments and going into a hyperbaric chamber and all of this fancy stuff. None of us can do that, but just little tiny things like I tell patients start with, don't eat processed white bread. Quit buying Wonder Bread or Bunny Bread. Start there. Get the organic whole grain bread. Little things. You get used to it, then you add another change. If you drink full test red Cokes, which is a ton of sugar, maybe try to reduce that amount per month, and then next month go down a little bit more. You have to make changes that you'll stick with and that don't stress you out, because stress is another form of inflammation. Nutrition and adjunctive methods, I'm going to talk about some of those. But remember, diabetes is a chronic inflammation problem, so you got to control the inflammation. Lifestyle changes, no fads. So none of this keto, Atkins, 30-day, whatever, all these fancy little fast diets. No, you gotta have a lifestyle change. So my personal favorite, and the one I really believe in, is the Mediterranean diet. And that we can do a whole talk on that perhaps next month. But this picture on the right kind of shows you where you're going. Blueberries, probably the healthiest thing you can eat next to olive oil, which is in the back there. Blueberry is antioxidant, anti-inflammatory at massive scales. Salmon, which gives you your omega-3s, so that depicting fish-based foods with omega-3s instead of omega-6s. And that's just a type of fatty acid that keeps those cell membranes we talked about healthy. And fruits and vegetables, obviously. So a Mediterranean or South Beach diet, I think, is the way to go if you can do it. And if you want me to give a talk on that, let me know, and I'm going to do that. Complementary Alternative Medicine, CAM. There's a whole National Institutes of Health department on CAM, believe it or not, look it up. There's tons of government money going into this, not even close to as much money as goes to cancer and heart disease, obviously. But the government is actually funding studies in this. So what we've learned is one of these natural treatments that, you know, a lot of your other doctors will say is for the tree huggers and the hippies. It actually works. There's been a lot of studies done in Germany and Europe, and then the NIH is looking at this too. Alpha lipoic acid, or ALA, to treat diabetic sensory polyneuropathy. So ALA is required for the cells to make energy. And remember, this is a metabolic disorder. It's a sulfur-containing compound, and it's highly antioxidant and anti-inflammatory. Remember, this is a chronic inflammation disease. It has been shown to improve your cell's sensitivity to insulin. Type 2 diabetes is an insulin sensitivity problem. It lowers your blood sugar, lowers your cholesterol, and increases the vessel tone. Remember, I talked about microcirculation problems. So we know that ALA, a natural treatment, is actually an awesome adjunctive treatment for diabetes and diabetic neuropathy. So IV infusions of ALA is the typical way, but you can take oral doses too. It's relatively expensive, I would say, because it's hard to source it well. In other words, to get a good API or you know, the factories that make these substances, you need to make sure it's a high quality place and not a backyard in a foreign country, we'll say. we can offer this treatment to you. We actually do IV infusions of ALA. The recommendations based on the literature are pretty stringent. It's a 3-week program daily, which obviously would just mean 5 days a week. And you come in and get an IV infusion of ALA, but it's had awesome results, and this has been proven in the literature. It's natural, almost no side effects, if any, and it's healthy for every other part of your body too because of the effects of inflammation and oxidation and reductions in those, and also helping cell membranes, which is massively important for brain health. Of 75,360 infusions studied, there were 0 adverse events. So we think this is a great adjunctive therapy, really for mitochondrial health and anti-aging, but especially for diabetes and diabetic neuropathy. So if you think that you have a relative or you might benefit from this, come talk to us about it and we can set up a program. Diabetic foot care, what do? Well, we talked about a lot of it. We will coordinate with your primary care, your endocrinologist, because that's important. They need to know what's going on. And if you have questions that only they can answer, or they have blood work we need to look at, we'll make sure that happens. You know, nowadays with big box medicine and huge systems that own everything, and most people are showing up at the hospital just punching a clock, a lot of information is just getting left aside, left on the fax machine, lost at the desk. We'll do everything we can to coordinate and gather all that information to make sure you have the best care. Again, we're experts in limb salvage, and we love diabetic foot ulcers because we love to see them go away. We love treating them to completion, to where we see patients walking around in just a basic diabetic shoe and insert. Speaking of which, we do that too. We're able to do a 3D scan of the foot and design and make a total contact diabetic insert, which if you're Medicare generally is covered. A lot of the private insurances for some reason won't cover this for people. I'm not sure why, but we can make diabetic shoes and inserts for you, as well as any specialized braces that are needed. And just know that we're here for you to give you your best life and give you optimal wellness. That's our goal. It just makes us so happy. And then again, what is covered? First question out of everybody's mouth, is this covered by my insurance? We'll make sure it is. I have a dedicated teammate that really works just to do that, to make sure that it's covered, and she'll let you know, have you met your deductible? What's your co-insurance? Have you met your out-of-pocket max? What's the copay? So on and so forth. You know, the insurance companies make it as difficult to understand as possible. We'll make it a little bit easier. Some of the alternative methods, like the ALA infusions and things like PRP and stem cells, which have great results for a lot of these problems, not covered by insurance, but we can talk about that and we offer it. I have a cryo tank with Wharton's jelly now, and we do PRP all the time. And again, don't forget Dr. Lindow's at-home wound care problem for people with diabetic foot wounds that have Medicare. The private pay insurances don't want us doing this. They want you to come to the office, but Medicare is very into letting people get treated in their home environment because it's less stressful. So hopefully that sort of let you know about diabetes, how to treat it, what it is, you know, everybody hears about diabetes, but now you know what it is actually, why the treatments are what they are, and what we do to help prevent amputation here at Warner Orthopedics. And we also will do everything else we can to help you feel good and optimally age, especially if you have diabetes. For instance, our physical therapy department are amazing at treating the human body that has been affected by diabetes. Everything gets tight, thick, fibrotic, the muscles don't work right, and we have a lot of methods that we've developed to help people function at a higher and better level with less pain with the diabetes. So please come see us. I think we can help you. Now we're going to take questions.
How do you do a Mediterranean diet on a limited income?
So good question. How do you do a Mediterranean diet on a limited income? So it sounds like you guys want a Mediterranean diet talk, so we'll put that on our list. Really, if you go to the grocery store and look, vegetables aren't, I don't want to say they're not inexpensive, but they're not as expensive as Cheetos if you think about it. So you can just get basic fruits and vegetables. You don't have to eat organic. Eating vegetables is better than not eating vegetables. Eating organic vegetables is better than eating regular vegetables, but still, it's better to get the phytochemicals and the nutrition for the Mediterranean diet out of the vegetables and the fruits than to not eat them at all. So you can just get basic on-sale blueberries or whatever. And then there's a lot of fish out there that are frozen, but they're still relatively high quality. Farm raised, obviously wild caught, organic would be better, but farm raised fish are perfectly fine because that's better than eating a grade E but edible hamburger, which is what you're gonna get when you go to fast food restaurants. I would say avoid highly processed foods because they're expensive. Try to learn how to make your own bread. First of all, it's fun. I make my own bread. It's satisfying. You know exactly what's going into it, and you can control the grains. And it tastes a heck of a lot better, I'll tell you, and it toasts better. And just try to, and the oils. Oil is probably the biggest thing. So if you're cooking with canola oil, peanut oil, soybean oil, that's your first place to start. Get olive oil. The best is extra virgin, obviously, but virgin olive oil is where you should probably start. You don't want refined olive oil because that's been processed through a factory and chemicals have been added to stabilize it. So try to find virgin olive oil. It does not have to be organic, and just switch your oils out to that. That alone will make such a massive change in your health because the ratio of omega-6 to omega-3 is much better in olive oil than any of the other commercially available oils. And olive oil has omega-9, which is really good for you, and that's really hard to find in most ingredients. So I would say the first thing, stop buying highly processed foods because gram for gram or pound for pound, they're the most expensive. Look for healthy fruits and vegetables, and then switch your oil to olive oil virgin. You can lower your sodium too, but I would focus more on the oils and eating more fruits and vegetables first because that's going to give you all the phytochemicals and the correct fatty acids. That was it. Well, this is a good audience. Y'all took that in. All right, well, maybe next time we'll talk about the Mediterranean diet and how to do it on a limited budget. That's a great question. Thank you for that. We're wrapping it up. Have a great day. Happy Thanksgiving. Take care of yourselves. Be safe. Try to eat olive oil, not regular oil. And please, please, please don't eat a deep fried turkey. Enjoy your holidays with your family because that too is good for your health.